So already I told you, inflammation is response of immune system in our body. What kind of response it is? It is a defensive response or defensive reaction. Defensive is nothing but fighting against. Fighting against what? As I told you already, fighting against offending agent, any agent. It could be pathogen or under that bacteria, virus, or any foreign object if entered into our body during accidents like that. So what it is doing by fighting against it? It is trying to neutralize the actions of foreign objects or control the actions of foreign objects in our body or to eliminate them completely. Not only that, it is also preparing the site for the repair. When there is injury, there has to be a healing process. So, in this inflammation itself, there is a step called as preparing the site for repair. If we want to see it as a definition, here how it is. Inflammation is a defensive reaction intended to neutralize, control, or eliminate the offending agent and to prepare the site for repair. So, this is the definition. This definition I have taken from Brunner and Siddharth textbook, which is Medical and Surgical Nursing. So, whenever you write in exams the definitions, if you give below that, if you make a small hyphen and write the textbook name, there will be a good opinion to your teacher who is correcting your paper, and chance of getting good score is there. One is types of inflammation. There are mainly two types of inflammation. One is acute and another one is chronic. So let's see what is acute and what is chronic in detail and their characteristics also. So always acute and chronic and their characteristics can be explained in these ways, like what is causing acute inflammation or chronic inflammation, that is causes of acute or chronic inflammation. The next one is onset, how quickly it will occur, whether it is rapid or slow. Duration, how long it takes. Then outcomes, what is the outcome if the person is affected with acute or chronic inflammation. So first of all, causes. For acute and chronic both, bacteria or pathogens are the commonest cause. And for acute inflammation, there is also another cause, that is tissue injury. Whereas for the chronic inflammation, pathogen is one of the cause, just like acute. However, pathogens that is being entered into our body will fail to be entered into our body. Usually, our immune system will react on them and it will try to neutralize or eliminate. But in condition of chronic, when it becomes chronic, our immune system becomes incapable of eliminating them or controlling them. So that is why chronic inflammation in that pathogens that the body cannot break down, which includes some types of virus or foreign bodies. So when the body is unable to fight against them or break them, it remains in the body for a longer time. As it is remaining in the body for longer time, that is why we are calling it as chronic inflammation. Hope this is clear for you. And there is also another cause for chronic inflammation, overactive immune responses. Okay, then the next thing is onset. Acute inflammation is always rapid, whereas chronic inflammation is slow. Duration. Not only here, students, at every place, whenever you come across words like acute and chronic, remember that acute is for shorter duration, it could be days to weeks, whereas chronic is for longer duration, that is from months to years. If any disease condition is, if a person is suffering with any disease condition for more than 6 months to years, then we can say it as chronic condition. In the same way, here acute inflammation will be there in person's body only for few days. That is why we are telling it as acute. If it is crossing the days and weeks of period, and if it is being, if the inflammation is still present in the body for more than 6 months or up to years, then we can tell it as chronic inflammation. So the next thing is outcomes. In case of outcome, acute is different from chronic. Like whenever there, if acute phase prolongs, then it becomes chronic. In acute phase, Either the person will get rid of inflammation, immune system is successful in eliminating the pathogen from person's body, then there will not be further problem. The acute inflammation will not become a chronic inflammation. If our body fails, then it will turn into the abscess, and then it becomes chronic condition. In chronic condition, the tissue that is being there in the affected area or affected system, they will die, they'll become thick, and further, as I told you in the definition, it will prepare the site for repair. So further, the site will get repaired so that there will be a formation of scar. So scar formation is will be present in connective tissues. I hope this is also clear for you. And the next one is inflammatory response, physiological changes during inflammation, or pathophysiology of inflammation. All of them are same. So before getting into details of this inflammatory response or physiological changes or pathophysiology, whatever we call it, I would like you to have a look of this picture. Here in this picture, the idea of placing this picture here is you have to understand that every tissue of our body is circulated or supplied with blood and circulated with lymphatic system. Lymphatic system is nothing but that's where the immune system is also some the immune things are also from lymphatic system. Okay, so every tissues are circulated with blood and lymphatic system. That is what you can see here. Tissues are at the background, and the supply of like circulation in the red and blue. Red is oxygenated blood and deoxygenated blood is in the blue color, and green part is lymphatic capillary. When you with this idea, let's get into a topic that is pathophysiology. Oh, coming to pathophysiology, students, consider this red color bar as a wall of blood vessels. Okay, so one side wall of blood vessels, and the yellow color is tissue part or cellular part. Okay, now let me explain first from the tissue part. So all the tissues that is being present in our body will consist of some kind of two cells. One is mast cells and another one is dendrites. One is mast and another one is dendrites. Whenever there is entrance of pathogen or foreign object into our body, that pathogen, even if there is some foreign object, there will be some pathogens on it. So they will release some kind of enzymes. Those enzymes are called as chemokines. Those enzymes are called as chemokines. This is the indication to the immune system in our body that there is some foreign body in our body. So let's fight against it. So this information will be given at the cellular or tissue level as well as in the circulation and to the immune system. And understand this is there will not be any stages in this process. Everything will happen one by one, not one by one at a time. At the cellular stage, the changes will take place. At the blood vessel stage, the changes will take place. Almost everything will take place one by one, or simultaneously. Okay. So whenever there is entrance of this release of chemokines from the pathogens, this indication will be mainly to the mast cells. These mast cells will release chemicals called as histamines. The black ones that I'm showing is histamines. Okay. These histamines will cause vasodilation. So whenever there is dilation, there will be gaps between cells of blood vessels. So in order to fulfill these gaps and to fight against pathogens that is being entered into our body, blood vessels will release neutrophils, B cells and T cells. Not only that, the histamines, as I told you, it is causing vasodilatation. Due to that, there is release of neutrophils, T cells, and B cells. Altogether, neutrophils, T cells, B cells, and dendrites. Do you remember dendrites? That is at tissue level or cellular level. Dendrites from the tissues, all of them will fight with pathogen. They will try to kill the pathogen or stop its effect on the body. Okay, now this is how it happens. This is how the reaction of our body towards pathogen that has been entered into the body. Here you will also have to remember, due to this process there will be pain, one of sign of inflammation. And this vasodilatation part, you remember it very well. I will discuss later in signs of inflammation. Due to this vasodilatation there will be increased blood circulation and increased uh, as there is increased blood circulation there will also be increased fluid into that area. These two things will takes place. So those changes we will see as first stage signs of inflammation. Okay, I hope this is clear for you. You can rewind the video if you want to understand again. If it is clear for you at one step, very good. I told you already at the end of pathophysiology, there is stage 1 signs of inflammation. Okay, that is called as cardinal signs of inflammation. Remember, students, this is very important Viva question. Some of the teachers they might ask you. Okay, now instead of starting from pain, let me start from redness and swelling. I told you already there will be vasodilation. Due to this vasodilation, increased circulation, blood circulation, that is why redness. I also told you there will be increased circulation so that the fluid also will be more to that area. Whenever there is increased blood circulation, more blood. Mm, so more plasma, more intravenous or interstitious fluids. So because of that, there will be swelling. Okay. The next thing is I told you there will be lot of action. Pathogens are our immune system is fighting with the pathogens, so there will be pain. If it is due to injury, then also there will be pain because there is injury. Okay, and heat. Whenever there is increased action of anything in the body, then there will be generation of heat. Here, so many immune system is responding in so many ways at the cellular level as well as at the vascular level. So due to that increased function, there will be increased production of heat. So if you touch the inflamed area, you will feel it is heat. Okay, and as there is inflammation, the person cannot move that particular area that has been inflamed or injured. Okay, yes, stage 2. The next one is stage 2 of inflammation. In this stage 2 of inflammation, exudation from wound will be there. If you remember, when I explained about acute and chronic characteristics of inflammation, outcome of acute inflammation, in that I told either the inflammation, the person will get healed from the inflammation, or there will be formation of abscess. Abscess is nothing but exudation. So after the cardinal signs of inflammation, if the inflammation still present in the body, the infection or pathogen, then the next stage is inflammation. In that stage, formation of exudation or abscess will takes place. Okay, so there are again 4 types of exudation. One is sanguinous serous sanguinous, purulent. So serous is clear fluid that secretes from the inflamed area. Sanguineous, if you see that secretions from the inflamed area, you will find bloody secretions from that part. It could be wound or anything. Serous sanguinous, combination of clear and bloody. When clear water and when blood mix it together, the redness will become less. So it could appear like pinkish in color. And the next one is purulent. Purulent is nothing but pus. Okay. Now in this image, it is up to you to identify what is what type of exudation. The first one is serous. If you identified it as serous, good. The second one is sanguineous. The third one is serous sanguineous. I told you when serous and sanguineous mix together, the darkness of the red color changes. It becomes pinkish in color. And the last one is purulent, that is pus. Whenever you have been to clinicals, if you identify the secretions from the wound or anything, you can see these type of four secretions. Okay, so you have to say that there is serous secretions from the wound, sanguineous secretions from the wound, or serous sanguineous secretions, or purulent secretions. That is how the nursing student should be. Okay, the next one is stage 3. This is almost like the inflammation has reached to the final stage, or the inflammation has been completely cleared, almost healing phase, we can say it as. So there will be a scar tissue formation. So once the scar is formed, then you can see in the picture, this is how it looks. From the childhood, if you met any injury or anything on our body itself, on your bodies, you can see some types of scar formations at one point. So I hope now you understand, like our body or your or mind body has gone through at different stages of inflammation and ended at stage 3 of inflammation, that is scar tissue formation. Okay. Now the next one is, as I told you already, this has been already covered, that is acute signs of inflammation and chronic signs of inflammation. I have covered acute signs, that is again, I think I've covered all acute and chronic both. However, there is other uh, information that I have to add with acute and chronic signs of inflammation. That is why this extra slide. So, in acute inflammation, this redness is also called as rubor. Increased heat is also called as scalor. Swelling is known as tumor. And pink color is called as dolor. Pain is called as dolor. And then loss of function is also called as functional Lisa. Some kind of examiners would expect you to tell these things whenever they ask you cardinal signs of inflammation. Instead of telling redness, increased heat, or swelling, you can also say rubor, calor, tumor, dolor, and functional lesia. This is why I added another slide here for you. Then there are extra other signs of inflammation, that is chronic inflammation. One is fever. Whenever the person reaches chronic stage, they will experience fever, leukocytosis, death of leukocytes, then malaise, anorexia, they won't feel hungry, and sepsis. Sepsis is nothing but infection in the body. Okay, guys, the next one. Thank you. I hope you all understood this topic. And before ending this presentation, I would like to thank everyone, all the viewers of my channel and the subscribers of my channel. And I also have to tell you that I'm trying to make the video as simple as possible and also making it is convenient to your exam presentation. The way how I am presenting here, if you do almost in the same way in your exam presentation, except the diagram which I've showed today, that I showed for the better understanding, you can make that into as a flow chart. You can do that very well. So I hope all this information that I'm giving you will help you to do best in your practical as well as theory examinations. See you again with another topic. Bye for now. Have a good day.